Come in.
Hi.
Oh, hi, Adrian. How are you?
Good. How are you?
Good, good. Okay. So I know that you called about possible, I think you said it was called phonophoresis for my for my patient that has the inflamed patellar tendon. Sorry.
No problem. I know it's late in the day. Did you just kind of want to know more about it, or?
Yes,
Yeah.
I don't think I've ever actually heard of it.
Oh.
So.
Okay, perfect. Well, first of all, so for that patellar tendon to decrease inflammation, ultrasound is a really good technique to not only for the inflammation but also for tissue healing. So what we'll do is, since it has that crystal inside of it, it uses sound waves to kind of go through the skin and penetrate into the tissue. And there's two different frequencies we can use on it, and there's a 3 megahertz and a 1 megahertz. And pretty much the 3 megahertz is what we would use to target for this patient, because it's more of a superficial area, and so it won't penetrate deep into the skin, but also it will give a thermal effect. And I know she's kind of out of that acute stage of inflammation or of this injury, so we're kind of okay with using that thermal effect because we're not worried about increasing blood flow as much anymore, but we're more worried about the tissue healing aspect. So that's what that ultrasound will do. But then on the other hand, to be able to use the phonophoresis, we would need some Voltaren gel, which is just an NSAID to be able to decrease that inflammation even more. So she could maybe possibly get some more range of motion or just functional gains just in her daily life. So then what we would do is, using that Voltaren gel, we would apply it right on the patellar tendon and then put the ultrasound gel over it. And then also use the ultrasound head to be able to go around that area to help the tissue enhance its ability to absorb the Voltaren gel, hopefully into that specific patellar tendon to decrease the inflammation and give those other functional gains. And pretty much evidence has stated overall that that thermal effect of ultrasound is what makes phonophoresis work, to let that Voltaren gel come into the tissue to decrease inflammation overall for the patients.
Okay, so basically we're just going to combine that NSAID with the ultrasound just to further enhance it.
Yeah.
So it's not just ultrasound working, it's both. So we're getting effect of both.
Yes, and I do know that the patient has previously used ultrasound, so she doesn't have any problems with that. So that's why I think maybe just using the Voltaren gel on top of it might just take it to the next step of healing.
Okay. Yeah, let's go ahead and try it. Let's go ahead. I will prescribe her the Voltaren gel and have her bring it in for you.
Okay, thank you so much.
Yeah,
Have a
no
good one.
problem. It's good seeing you.